Okay, so let's finish off with the section 9 hematological alterations. That's where we have left actually. So, in hematological alterations, there is no changes in interpreting peripheral blood smear, anemia and polycythemia, disorders of granulocytosis and monocytes, bleeding and thrombosis, and even enlargement of lymph nodes and spleen. There are no changes. In pharmacology, the principles of clinical pharmacology, there are some changes, like this table has been changed. It has been simplified, the drug interactions, but the theme is same, but the table has been completely changed. So you would have to go through this table, and some more has been removed. Like in the interaction between drugs, there was some 3-4 paragraphs were there that has been removed, and directly they went into adverse drug reactions. And in adverse drug reactions, and all everything is same. The pharmacogenomics is also same. There are no changes as such. And next is the section 1 of the part 4, that is neoplastic disorders. In this we will complete up to cancer of the skin. So in approach to the patient with cancer, the data has been extended till 2021. So there will be some changes in the data numbers, but as such the order is same everywhere. Even this also the order is same, but it has been extended into 2017. Earlier it was 2013. Similarly, it has been, the data is covered till 2018, but the arrangement or the order of cancers is same. There is no difference in the order of cancer. Only the data and the numbers have been changed, and it has been updated. This is the new global maps showing the distribution of cancer in 2018. So this is also updated to 18. Other things are same. Other things like these are same. And when coming to the nausea, vomiting, effusions, these are all same. Only in the treatment part there has been a lot of addition. Prevention and early detection of cancer. Also, only thing is that this diet modification, even in physical activity and smoking cessation, there was some more information over there that has been removed now. There is not that much information, but everything else is same. Cancer chemo prevention, there is in upper aerodigestives, this carrot was there. This aspri trial has been added in chemo prevention of colon cancer in the new edition. You should go through this trial once. And chemo prevention of breast cancer, prostate cancer, vaccines and cancer prevention are same. Surgical cancer prevention, cancer screening are all appears to be same. Here, this screening recommendation for asymptomatic subjects not known to be at increased risk for the target condition needs revision. As you can see, there is a lot of change in adults more than 45 years. Earlier it was adults more than 50 years. Similarly, there is slight changes in the years of patients being screened, and you would have to go through this 70.3 again. It's maybe very important for the future examinations. And again, in this colorectal cancer, I feel there is some more development in colorectal cancer than any other cancers. So please go through the colorectal cancer screening or prevention or everything related to cancers in colorectal cancer. Other than that, all other cancers appear same. There is no much differences. In cancer genetics, as you know, there is more addition to the genetics in the form of checkpoint inhibitors. Other than that, everything else will be same in every chapter. So these are all earlier also same, and the genetics has not been changed. Like this tumor heterogeneity, the diagram has been changed, and even the description has been changed. But as such, the type 1, type 2, type 3, type 4 are similar. But in diagram you can see the much more difference needed. You can go through the diagram, it is easier to grasp. cancer cell biology, there have been few changes in cancer cell biology. First is that they here this RASC inhibitors, you can see RASC inhibitors have been added. Earlier there was a single drug here in CDKHB inhibitors. This is now been renamed as CDKHB inhibitors. Other than that, everything else is same. In drug list, there are lots added in antibody chemotherapy conjugates and CAR T cells. CAR T cells have been changed. Their brand name has been changed and pharmaceutical name has been added. So these tables are very important. 17.2 for CAR T and antibody chemotherapy conjugates, and also for monoclonal antibodies alone. And other than that, these things are same. Cas spaces and are all same. There is a new addition of table at the end, primarily for the checkpoint inhibitors, that is inhibition of T cell activation against cancer cell by engagement of co-inhibitory molecules. This is one PD1, PDL1, CTLA4 inhibitors. This is a new thing in cancer, in hematology, CAR T cells and this PD or CTLA4 inhibitors. Cancer, hematology and in rheumatology, they will be appearing again and again, and you will be looking a lot about CAR T cells this time. And if any hematology or rheumatology questions will come, they will be targeting this CAR T and PDLA, CTLA inhibitors. So you have to go through them, because you can see that there is a lot of addition of CAR T here. In principles of cancer treatment also, you can expect that monoclonal antibodies have been taken the first place. They have been given systemic cancer therapy. So in the beginning only they have been. This is also 17.3 tumor growth and death pathways affecting the target and cytotoxic agents. It's been changed. It's a new table, a new figure. You have to go through the 17.3. After that, the earlier edition, it was the cytotoxic drugs, but here the first to come is cancer biologic therapy. So biological therapy comes first, antibody mediated therapeutic approaches. This whole thing is figure 73.4 is a new figure, very important figure, and lot of information you can get it from this figure alone. So as such, the next few pages will be focused on these things only, like CAR T, CTLA inhibitors, 4 inhibitors and all. You have to read those things. And then comes the cancer cytotoxic therapy. This is the blah 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 of the previous book only. There nothing has been changed till the treatment part. In the treatment part, they have added in the treatment part for the vomiting, nausea and vomiting, the treatment part has been changed. More and more of serotonin antagonists and neurokinin receptor antagonists are useful in high-risk chemotherapeutic regimens, and they have given regimens also, like MSS from low emetic risk regimens may be prevented with 8 mg dexamethasone alone, or with non-5-HT3 non-NK1 antagonist approaches, including the following. So they have given a clear-cut regimens for here, and practice guidelines endorsed its earlier use in adults receiving highly hematogenic chemotherapy agents combination with NK1 antagonist plus an HT3 antagonist plus dexamethasone. This combination has become now rule. They are giving a lot. Other than that, everything else is similar. Infections in patients with cancer, there is absolutely no difference. This chapter has been taken and cut paste similarly. Even oncological emergencies also, there is no big changes in the oncological emergency. The chapter has been put as it was earlier. There is no change in this chapter also. So what we came was the cancer of skin. This we will discuss on the next chapter, next discussion. Thank you.